On this episode, we'll talk about glucose levels after your surgery. We'll talk about how does BMI work, and we'll talk about medical ID bracelets. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 154 of the AskDrA show. Thank you so much, you, the patients out there, for sending these great questions. That's what we're here for. We're here for you. I am here to dedicate this time to answer some questions that you may have and just to be of value to you guys. So if there's anything I can do to help you guys, if there's anything I can do to answer any questions that you guys may have, please let me know. So two ways, you may know already, two ways to get your questions to me. One is using the hashtag AskDrA throughout social media, and the easiest way is probably through my Instagram account that I personally manage, and you stop by and say hello. All right, so I'll say hello back to you guys. All right, let's go into the show.
Is it normal if my glucose levels rise after having a gastric sleeve?
Okay, this is a really good question, specifically on patients who are diabetics, because after you get your surgery, the stress of the surgery, not the psychological stress, the physical stress your body goes through while surgery, spikes up cortisol levels, and that of course goes by the hand with glucose levels. All right, so that means the next few days after surgery, there will be an increase of your glucose readings. Don't be alarmed. Your doctor knows about this. We know about this, and we are actually expecting this. All right. After a few days, day 4, day 5, day 7 or so, then the surgery kicks in its effect, and your glucose levels start to lower. So normal to expect some higher glucose levels after surgery, diabetic patients, okay?
How does the BMI work?
Okay, really good question, because the BMI, body mass index, is one of the most important criteria to know who really is a candidate for weight loss surgery and who isn't a candidate for weight loss surgery. Body mass index is a calculation, is a formula using two things, using your height and your weight. If you can get your height and your weight, you can calculate your body mass index, your BMI. Easiest way, probably download an application on your phone, BMI, or go to my website. I have a BMI calculator right there, or just Google BMI calculator and you'll find one, and just enter your height and your weight and you'll get your BMI, your body mass index. That will be a big indicator on who is a candidate for weight loss surgery and who isn't.
Are medical bracelets necessary?
Okay, so back in the old days, I mean over 10 years ago, I personally would give out the medical ID bracelets to my patients, and I would have them engraved for my patients. And then after a few years, I mean, we noticed that there really isn't much case to wearing these ID bracelets. Why? Because there really isn't any risk unless you get hit by a car, you're totally unconscious, you go to the ER the first 2 or 3 weeks after surgery. The possibility of that is very minimum. After that, after your sleeve has healed, the chance of hurting that sleeve, you being unconscious, would be very slight. But you being conscious, you can tell the doctor if you get a prescription for a medication for some other source. You broke your knee, you're hurting, you got prescribed some anti-inflammatories. You can tell the doctor, you being awake, tell the doctor that you can't take a certain type of medication with your sleeve because you had a sleeve surgery, and that would be NSAIDs, which is non-steroidal anti-inflammatory drugs, and we've talked about that several times on the show before. So there really isn't any good justification to wearing these medical ID bracelets. All right, so that's it for episode 154 of the Ask Dr. A show. Listen, if you guys aren't following me on Instagram, we have a big giveaway. You don't want to miss out, all right? So I'll see you there. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.